something wrong with me.
Is she gonna die? Was I gonna be a single dad?
It was just so unbelievable. I was just in this state of shock.
I was worried for my life.
She could end up crippled or in a wheelchair.
My heart was breaking. My daughter's sick, there's something wrong.
Next, two medical mysteries that defied the experts. Rachel Crawford was intent on donating bone marrow to her brother who was suffering with a serious disease, until a dangerous illness of her own changed everything.
I look down at my 18-month-old daughter playing, and I think to myself, there's absolutely no way that I can be sick, not when my little brother has leukemia. It was as if someone had kicked me in the stomach.
Then, Jennifer Pollitt was sure life would be great once her crossed eyes were fixed, until she discovered that her eyes would be the least of her problems.
I thought that every morning I was going to wake up and not be able to move another part of my body.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. Both Rachel and Adam Crawford of Portland, Oregon, had been eager to start a family for as long as either of them could remember. And sure enough, less than a year after their marriage in 2003, they found themselves anxiously awaiting the birth of their first child.
We were so excited to be expecting our first baby. We had just bought a new house, so we had a lot of transitions going on.
But at 8 months, during a routine prenatal checkup, Rachel gets some scary news. She has preeclampsia, a condition that reduces blood flow to major organs, including the uterus, and puts both mother and baby in grave danger. Rachel's doctor quickly decides that he does not want to take any chances.
And in the midst of that appointment, the doctor said, "You're gonna have to deliver the baby today." And I just kept thinking to myself, I'm not at that point in the book yet. What to expect when you're expecting. I haven't gotten to that chapter.
I was scared. I was not prepared to be a father yet. I still had 2 months to prepare to be a father, first-time father at that.
And so with that hustle of nurses and an anesthesiologist, and they were wheeling me in for a C-section.
Baby Sophia is born at 4 pounds. Despite her premature birth, she is completely healthy. Right after the delivery, Rachel's blood pressure goes down, all the preeclampsia symptoms disappear, and after a few weeks, the family is discharged from the hospital.
Even though she was 8 weeks early, we were absolutely thrilled.
It was pure joy. We had, obviously had a couple weeks with her in the NICU, so I had gotten to know her there and spent time really as a new family in the hospital.
And it was just the most joyous experience bringing this baby that we wanted so badly into our home.
But 4 months later, Rachel and Adam receive an upsetting phone call about her 23-year-old brother, Robbie.
My cell phone rings at 7 o'clock in the morning, and it's my mom crying on the other line, and I said, "Mom, what is wrong?" Thinking someone had died. And she said, "Your brother's in the hospital. He has leukemia."
She took the news very hard, as did the whole family. This was, wow, this is cancer. This is serious.
I thought leukemia was something that just happened to little kids. It was just a big shock to me and my family. Never thought something like that would, happen to you.
As his big sister, it was almost like my own child having something happen, and I was absolutely heartbroken and scared out of my mind.
It's clear that Robbie needs a bone marrow transplant, and after a flurry of testing, his doctors determined that Rachel would be a perfect donor.
So the plan was set in motion that I would be able to become his donor that next fall.
The transplant is 12 months away, scheduled for the following September. But 6 months later, in March, Rachel herself starts to feel sick.
I started having just really odd stomach pains where I thought I must be getting the flu, or it must have been something that I ate.
It would come in waves where she would be feeling poorly, but then within a matter of moments start feeling even worse, where she would be doubled over and feeling extremely uncomfortable.
You know, having had a C-section with my daughter, part of me wondered if it was associated with postpartum.
It was something that I really didn't think about too much as being something to take note of or something to be concerned about.
Rachel schedules an appointment with a gastroenterologist who performs an ultrasound of her abdomen. He reassures her that everything looks normal and prescribes some pain medication.
And they told me, you know, can't really put our finger on it, but since all your labs came back regular and the ultrasound will just let us know if you end up having any other stomach issues.
Around the same time, Rachel notices something else. When she goes to the bathroom in the morning, her urine seems especially dark.
I chalked that up to being dehydrated and not having, you know, enough in my system during these bugs that I thought I was having.
With the medication, Rachel begins to feel some relief. But a few months later, while exercising, she experiences another unsettling symptom.
I would get these odd headaches doing yoga or working out. I felt as if I was looking into the sun, or there was some sort of bright light that was making me squint. I would take aspirin, a pain reliever, but by and large, I thought it could be related to the stress of the transplant. So I didn't really think anything of it, that it needed to be dealt with a doctor.
But then, with Robbie's bone marrow transplant just weeks away, she and Adam receive some alarming news.
I get a call from work, and she sounded upset, saying that I had been approved for life insurance coverage, but she had not, because of some blood work showing abnormal results.
One of which was an LDH, which I had never heard of and didn't know anything about, but apparently it was way over what it should be.
LDH, or lactate dehydrogenase, is a substance found in red blood cells. Too much of it can sometimes indicate the presence of cancer.
It obviously sent off alarm bells, and we were looking to speak with someone who could educate us more on what this number meant and what do we need to do in order to move past this and to understand what it is.
It never really occurred to me that there might be something wrong with Rachel. I just didn't think it was possible.
I was looking down at my 18-month-old daughter, thinking to myself, you have got to be kidding.
29-year-old Rachel Crawford is just weeks away from donating bone marrow in an effort to cure her brother's leukemia, when she gets some test results back that indicate that she herself may have cancer.
We were scared. I was scared.
Not only are Rachel and Adam terrified about the prospect of cancer, but this may also prevent her from donating bone marrow to Robbie. Now 2 lives could be at risk.
I think to myself, there's absolutely no way that I can be sick, not when, you know, here my little brother has leukemia.
Rachel's primary care physician refers her to hematologist-oncologist Dr. Frederick I to take a closer look at the abnormal test results.
An elevated LDH can mean many things. It could signify muscle damage, it could signify a malignancy or infection. It's pretty nonspecific. It's a marker of something. The question is, what is it a marker of?
Dr. I runs a complete blood panel, and to rule out any early form of cancer, also performs a bone marrow biopsy.
We looked really hard and couldn't find anything wrong with her.
Dr. I said, you know, I think you'll still be able to move forward as being your brother's bone marrow donor. And I was just so glad to have that month over.
But Rachel's hope is short-lived. Just a few weeks later, she is stricken with the same stomach pains and nausea that she had after the birth of Sophia.
There was one instance where I literally sat up in bed and threw up.
Given their recent health scares and not wanting to take any chances, Adam rushes her to the ER.
We were seen by a doctor and gives her fluids, made her more comfortable, and says, you know, just to rule something out, we're just gonna scan your abdomen.
doctor came in and said there looks to be some sort of ulcer. So it was actually kind of a relief that, here was something wrong with me and now was remedied.
The ER doctor gives Rachel some antacids, along with a recommendation to avoid spicy foods and follow up with her primary care physician.
With that, I was checked out of the hospital and able to go home.
And then, 4 weeks later, in October, they get another surprise. Rachel is pregnant again.
We were thrilled to learn that we'd be having a second baby, although this did mean that we would be, again, postponing the bone marrow transplant.
Robbie's leukemia treatments are working well, and his doctors feel he can withstand the delay, so the transplant is put on hold for another year. Adam and Rachel, in the meantime, gear up for baby number 2.
We were excited to tell our friends and family and looking forward to a new addition.
But 4 weeks later, just at the end of her first trimester, Rachel starts having headaches again.
And this time around, they were different than the ones that I had previously experienced because there was no relieving the pain. As I was pregnant, I didn't want to take any medication, and that was a little scary, but I just thought it must be hormones.
Rachel does her best to gut it out. But on Thanksgiving, at her parents' house, she finally just hits the wall.
We were all sitting around the table, enjoying one another's company, except that I felt horrible. I had the worst pain in my head to the point that it hurt to try to chew. So I gently excused myself and just said, I'm feeling really tired and, being pregnant, I'm just gonna go lay down upstairs.
Adam cuts the visit short and takes Rachel home.
And as we're driving home, the pressure in my head is just growing and growing. And I'm starting to feel a little panicked that the pain isn't going to subside. There's not kind of a light at the end of this.
She was in excruciating pain and was saying that she felt very nauseous. And when we pulled up into the driveway, she vomited right on the driveway.
And Adam helps me into the house and gets me upstairs. And I remember laying in bed thinking that it hurt to open or close my eyes, that I could feel the pressure just from breathing. There was no way of escaping the pain. I told Adam, I feel like taking a nail and sticking it between my eyes because the pressure in my head is unreal. And at this point I start really crying and breaking down, and he sees from the look in my eye that this is not just a headache.
Now beside himself with worry, Adam once again drives his pregnant wife to the ER.
And we see a doctor, and he was kind of outgoing, making us feel comfortable. Your wife's pregnant, there wasn't anything to be worried about, but just to rule anything out, we're just gonna scan.
Rachel undergoes a CT scan of her brain.
And then they sent us back to our room to wait for the CAT scan results.
And I remember sitting on a chair.
We overhear the doctor say, "Oh, I was not expecting that." And for just a split second, I thought, he is not talking about me. Please, God, he is not talking about me.
Minutes later, to her horror, Rachel discovers that it is indeed she that he was talking about.
The doctor comes in and says, "You have a brain tumor. And we are going to need to check you into ICU and have a neurosurgeon come speak with you about doing brain surgery."
I was so upset I couldn't cry. I was in a state of shock. Is she gonna die? Was I gonna be a single dad?
Although the brain surgery is clearly risky for the fetus, the alternative could mean death for both the baby and Rachel. Doctors book Rachel into the first open OR.
Everything at that point happened very quickly. There was a flurry of activity, numerous nurses trying to get her situated in the room, get vitals, plugging her into equipment monitoring her heart and her heart rate.
A neurosurgeon came in and said we were looking at surgery happening that next morning or early afternoon. And I gave hugs and kisses and, told my family that I loved them and made peace with myself that whatever was going to happen in the surgery, that I was okay, but I wanted to live.
Early the next morning, Rachel is prepped for brain surgery. All her pre-op tests are run, and part of her head is shaved. But as she is being wheeled to the OR, everything changes.
So the nurse stopped the gurney, and I hear her on the phone saying, "Wow, I've actually never had this happen before. Okay, all right, we'll go ahead and do that." She hangs up the phone and looks at me and says, "Well, today is your lucky day. We're taking you back to ICU. You're not having brain surgery. They think it's something else."
Just minutes before Rachel Crawford, 12 weeks pregnant, is slated to go under the knife for emergency brain surgery, new test results come in, and she's wheeled back to the ICU.
I was so dumbfounded. I honestly didn't know what to think or to say.
For over a year, Rachel's unusual stomach pains and throbbing headaches have been a complete mystery. But she doesn't know whether to laugh or cry at what she hears next. Now doctors believe that Rachel does not have a brain tumor after all, but instead has suffered a stroke.
At this point, I'm, just thinking about this poor baby that I'm trying to grow inside me.
Doctors assure Rachel that the fetus is fine and the stroke did not cause any damage. She is put on a regimen of blood thinners and told to come back for monitoring in a few weeks. For the next month, Rachel feels fine.
I, at this point, was almost 12 weeks, so we were finally taking a deep breath and allowing ourselves to look forward to the Christmas time together and look forward to this pregnancy and this baby.
But 1 month later, on the morning of Christmas Eve, something horrible happens.
I remember laying in bed and I felt just this rush, and I rushed to the bathroom and saw that I was bleeding, and I knew in my gut that I was having a miscarriage.
There was never a point where the situation ever felt truly real. It was almost as if I was witnessing something taking place to someone else, trying to accept it that it was actually me and my family.
Rachel does her best to recover from the emotional blow of the miscarriage, and instead directs her attention to the upcoming bone marrow transplant with her brother who has leukemia.
Mentally, I shifted my focus from the loss of this child to being able to give my brother a second chance at life.
Then, just 4 weeks later, the now familiar stomach pains and vomiting return, but this time there's no relief.
Adam would get me in the car and rush me into the ER, and we would end up seeing a GI doctor who would perform a scope to look at my stomach to make sure that I wasn't having some organ damage. This pattern started copying itself over and over again about every 2 weeks.
It was a cycle that we couldn't get out of. We knew that was the only way for her to get relief was hospitalization and IV medication.
I was so frustrated that nobody could tell me what was wrong with me. And at this point, I knew that there was something wrong with me.
Then, in March 2006, during one of her stays in the ER, Rachel finally decides she's had enough. She calls Dr. I, the hematologist who she met with several months earlier.
So Dr. I, it's Rachel Crawford. I am in the hospital again. Nobody knows what's wrong with me. I haven't seen a doctor in 2 days. I am so desperate. I said, "Help me, Obi-Wan Kenobi, you're my only hope."
Rachel was terrified. She was miserable. She'd been sick in and out of the hospital for a couple of months at least, and really didn't have a diagnosis.
Dr. I immediately takes over the case and is quickly briefed about Rachel's past year of suffering, from the emotional pain, vomiting, and the headaches, to the stroke and the miscarriage. He decides to focus on Rachel's current symptom.
Looking for causes of her abdominal pain, we did a CAT scan and a liver biopsy.
And what the tests reveal is shocking.
And the liver biopsy suggested there was blockage of blood flow through the liver.
This blood clot that Dr. I has found is a rare condition known as Budd-Chiari, a coagulation that forms in the main vein that takes blood from the liver.
It can result in acute liver failure, even in death. Rachel's lucky.
And the fact that she has this symptom in particular also tells him a lot.
When you find this condition, Budd-Chiari syndrome, there's really a very small list of things that'll cause that. The liver biopsy ruled out certain things like malignancy or cancer or hepatitis, or liver infection.
Dr. I explained to me we are one step closer to finding out what is wrong with you.
Dr. Frederick I is one test away from knowing the exact disease that has been plaguing Rachel Crawford for over a year.
Seeing the Budd-Chiari syndrome and then going, oh gosh, the blood clot and the high LDH and the dark urine, boom. I mean, you look at it and you go, oh gosh, why didn't I think of it before? The aha moment, if you will.
To confirm his hunch, Dr. I orders a final test called flow cytometry that will give him a better look at Rachel's red blood cells. The results come back positive for what Dr. I suspects. Rachel has paroxysmal nocturnal hemoglobinuria.
I was shocked because we had been waiting for a diagnosis, but this is something I had never heard of.
In individuals with PNH, the red blood cells lack a protein that normally protects them from breaking down, a process called hemolysis. Because the cells are missing the protective protein, they fall apart easily, and some of the leftover pieces can coagulate, causing blood clots, while some blood residue is also filtered out by the kidney into the urine, turning it dark. PNH could also explain the loss of Rachel's second pregnancy.
Blood clots being a key part of the condition. She certainly could have had a blood clot during pregnancy in the placenta leading to the miscarriage.
And it's clear that Rachel herself was in grave danger too.
The blood clots are the most dangerous part of the condition. The blood clots in the lung, blood clots in the leg, strokes. If it's extremely rapid, people can get quite ill and even die.
I remember feeling such a sense of relief that I had lived through these episodes without dying.
While thrilled to finally have a diagnosis, the couple remains baffled by the way in which the disease progressed.
Why the PNH flared up and caused the series of problems leading to the diagnosis, I don't think anybody will ever know. It's just the way the disease behaves. It's unpredictable and can come and go. And so over the period of time she was having symptoms, she was developing clots, and eventually the clot became large enough and big enough to affect the liver in a way that led us to find it.
After some internet research on their own, Rachel and Adam come to a staggering realization. The only known cure for PNH is something they have come to know a lot about: a bone marrow transplant.
I was stunned. I just could not believe that I was in the same boat as my brother.
But Dr. I informs Rachel there is a new drug in the experimental phase that could counteract the cell damage and manage Rachel's PNH with little risk of side effects. After just one infusion, Rachel feels the effects of the new drug begin to take hold.
I actually felt like myself. My energy was back, and it was the most incredible feeling that we would be able to start living our life normal again.
Luckily, Rachel's brother Robbie finds another donor for his own bone marrow transplant.
We're all definitely a lot more appreciative of each other. I mean, not taking each other for granted or taking the closeness of our family for granted.
I think the most difficult part in this is that it would be dangerous for me to get pregnant again. And I do look at the baby that I lost as really helping them figure out what disease I had if I hadn't been pregnant that second time. and had the stroke and the blood clot, we wouldn't have been able to come up with a diagnosis as soon as we had.
Rachel Crawford kept no secrets about her health. But for Jennifer Pollitt, admitting that something might be seriously wrong with her was the hardest thing she ever had to do. In 1997, Jennifer Pollitt was an active 14-year-old. Until middle school, her only experience with doctors was a string of surgeries that would ultimately correct her crossed eyes, a condition she was born with.
Elementary school was a torture at sometimes, but for the most part, I had a lot of family and support from my friends, so it wasn't as bad as it could have been.
Otherwise, Jennifer was outgoing, upbeat, and the picture of health.
I did a lot of dance. I started dance at a very young age, and I really fell into that as my niche.
She was a great kid. She was very studious, always helping everybody out. She was a good friend to everybody.
But then, one day, out of nowhere, Jennifer notices something strange.
I discovered sores on my scalp and my nose. I was itchy or scratchy, or, I could see, my dry skin like flaking off.
And she'd say, "Ma, look, I don't know what's going on. Look, I have this sore in my nose and in my hair." I said, "Auntie Anna has psoriasis. Maybe it's psoriasis." I really did not know what to think. So I said, just watch it.
And we basically went and bought some special shampoo. And after using it for a while, the sores just went away. And I didn't think too much about them after that.
Now the only thing on her mind is having the final surgery to correct her crossed eyes once and for all. She knows that she'll be much more comfortable starting high school once this is taken care of. But during her last pre-surgery exam, the ophthalmologist notices something unusual.
She explained that when he was doing my dilated eye exam, he found inflammatory cells in the anterior chamber of my eye, and that was called uveitis. So before we could continue with surgery, I had to get the uveitis under control.
Uveitis, an inflammation of the middle layer of the eye, can be caused by various conditions. However, in many cases, its cause is totally unknown.
He ordered a complete blood panel, and all of my blood work came back absolutely negative. There was no rhyme or reason as to why I had this uveitis. And basically, he said that it could just remain dormant.
He prescribed steroid drops that she'd have to take every day and come back every week. We'd have to follow up.
A few months after the uveitis clears up, Jennifer undergoes her final surgery. She is thrilled to get back to her life, and the rest of her high school years are trouble-free.
All of my follow-up exams were completely normal. My eyes were completely dead on target. It was great.
But at the end of her senior year, just as she is about to graduate, Jennifer notices something new.
I started to notice that I was having problems with my elbow. It was a tense, locking pain in my joint.
Hoping it will be dealt with simply, Jennifer pays a visit to a chiropractor.
And the doctor said that it was just tennis elbow, and that it was very common for dancers to have these typical aches, pains.
The chiropractor puts her on a course of anti-inflammatory drugs and instructs Jennifer to wear a brace.
It kind of subsided a little bit, and I thought that it was just over.
At the end of that summer, she heads off to college.
I had a lot of credits and a lot of classes, and I was finally excited to just be relaxed.
But that winter break, while visiting home, Jennifer wakes up one morning and notices something is terribly wrong.
I slept on my parents' couch that night, and I woke up the next morning and realized that my arm was locked, but this time it wasn't getting any better. It was actually stuck.
In just 6 months, college freshman Jennifer Pollitt's elbow has gone from a little swollen to completely locked. Panicked, she visits her chiropractor for a second time.
The chiropractor said, "Oh, I've seen this a million times. Do some physical therapy and really try to rest and, ice and heat and ice and heat. And within a couple of weeks, you should feel great." But it just wasn't enough to where my arm was ever back to what it had been previously.
Next, Jennifer seeks the advice of an orthopedist, hoping that an MRI might be able to pinpoint the problem.
They were kind of baffled. Every scan, every x-ray looked normal, but here I was and I couldn't move my arm.
Her doctors decide to pursue a course of cortisone shots, physical therapy, and anti-inflammatory drugs, confident that this should get the stiffness and pain under control. But despite these efforts, in the course of 6 months, Jennifer's elbow remains stuck in place and has lost 50% of its range of motion.
It was absolutely my secret. I didn't want anyone to know. I had been tortured as a child having crossed eyes, and I didn't want the same stigma to follow me around now for the rest of my life because my arm wouldn't straighten anymore.
Jennifer continues to consult an orthopedist and a physical therapist, and she adds to that list a kinesiologist, a specialist who deals with muscles and mobility.
We did a lot of ultrasound and hydrotherapy, and I realized that it started to feel a little bit better, but it still wasn't back to normal.
Despite the ongoing discomfort, Jennifer does her best to get on with her life. During her sophomore year, while working as an optician at an eye clinic, she starts dating Damon Chandler, an ophthalmologist training at the clinic.
First day that she worked there, I thought that she was very cute, and never knew that I would actually end up going on a date with her or anything.
And she called me next, she said, well, I don't know why, but I'm gonna marry this guy someday, I just know it.
Jennifer is thrilled to be in a new relationship. However, it presents a problem. How will she hide her elbow from her new boyfriend?
I didn't let on that I had any type of physical problem. I didn't want to appear weak. I would position myself so I either had my hands on my hip or my hands were crossed or in my pockets. So I had all the tricks down. So it wasn't until about 6 months later, we were at his apartment and we were just play fighting, pillow fighting. And he landed half on top of me and I just screamed out in the loudest shriek I could possibly imagine because my arm had been locked in a position at almost a 90-degree angle for so long. It was just excruciating.
As her boyfriend, he is concerned about Jennifer's pain, but as a doctor in training, it piques his interest. And as Jennifer begins to feel closer to Damon, she opens up a bit more about her medical past.
I told him that I had the uveitis, that all of my blood work came back negative. They just don't know what it is.
I kind of responded like, are you kidding? What do you mean you had uveitis? She kind of brushed me aside and said that the doctors had done every test possible and that those tests all showed nothing, and she didn't know anything more about it, but she knew that it wasn't a concern for her any longer.
But one thing Damon knows is that uveitis should be taken seriously.
I had always learned that conditions like uveitis can be associated with systemic conditions. And it seemed obvious to me that for Jennifer, this might be the case.
While very concerned, Damon is still sensitive about meddling too much and decides to keep an eye on Jennifer secretly. But in July 2005, after the couple moves to Florida, they both begin to notice that Jennifer is developing other problems.
I mean, my knee was just enormously swollen with fluid all around it. It was the size of like a grapefruit, and the pressure was so bad that I couldn't bend my leg.
My greatest fear was that, God forbid, anything should happen to her knee that would even resemble what happened to her elbow.
My knee got progressively worse. I would put ice on it. It was just a huge pressure that felt like my knee was gonna explode. I would take ibuprofen like it was a tic-tac.
Certain that this must be a skeletal problem, Jennifer consults another orthopedist.
The orthopedist said, oh, you know, this looks exactly like a torn meniscus. So I said, oh, thank goodness, we know what this is. I'm so excited.
An MRI is scheduled immediately, and Jennifer is optimistic.
He was hopeful that it might be a simple arthroscopic surgical procedure that could repair the damage, and that would be the end of the story.
I went back for the MRI results, and the orthopedist looked at me very concerned and said, you need to go to a rheumatologist immediately. We can't help you here.
Growing more alarmed by the minute, Jennifer tracks down a local rheumatologist.
He gave me no answers. We tried a lot of different medications and a lot of different injections, and nothing seemed to work. My knee was still swollen. I cried my eyes out. I was devastated. I knew the condition of my elbow, and having your arm not work is one thing, but having your leg not work, I can't be in a wheelchair, I can't be on crutches.
Not knowing where else to turn, Jennifer continues to see the rheumatologist every 2 weeks, but makes little progress. The doctor tries a variety of medications and runs several tests, all of which come back normal. Jennifer is at her wit's end.
what was going on with Jennifer's body was affecting her emotionally as well. It was a great strain on our relationship.
Jennifer is barely eating and begins to rapidly lose weight.
It's just like, just please, God, don't let her have anything that's gonna take her from me.
Jennifer tries to make the best of her painful symptoms, but 3 months later, she wakes up to yet another surprise.
I was doing my hair, and I realized that my thumb was very sore and it was stuck. It was stuck like my elbow was now stuck. It was stuck like my knee was getting stuck. I couldn't move my thumb.
She mentions this new pain to her rheumatologist, who is not sure what to make of it.
I thought that every morning I was gonna wake up and not be able to move another part of my body. I thought that eventually, if we didn't figure out what this was, that one by one, my joints were all going to be immobile, and I would just end up being completely paralyzed.
Even though she'd say, Ma, don't worry, I'll be fine, but I could feel the tension in her voice.
And just when Jennifer thinks it cannot get any worse, something else happens.
I was in the shower one morning and I realized that I was scrubbing my hair with shampoo and my head itched a lot, so I started to scratch kind of vigorously. And when I removed my fingers, I saw blood. And so then I got out of the shower immediately and looked in the mirror and realized that I had tiny little sores all over my scalp. And I just knew that the sores are back with vengeance. They're not small anymore, they're a little bit larger. They're on the back of my head, on the top of my head.
A month later, Damon and Jennifer visit her family for Christmas, and her relatives are horrified at the way she looks.
I was about 87 pounds coming home that December. I was pale. I had these sores on my nose that bled. My scalp, I was constantly itching my scalp. My knee was the size of a grapefruit. I couldn't move my thumb. I just looked like a disaster.
I looked at her, I said, oh my God. She looked awful. She looked just so frail, like weak, pale, thin. I said, my daughter's sick, there's something wrong.
Jennifer Pollitt's family can't believe how bad she looks. For the past 4 years, she has lost mobility in her arm, leg, and thumb. She's depressed, she's in pain, and no doctor can tell her why. While at Jennifer's parents' home for Christmas, Damon decides it is time to take control of the situation.
He finally said, okay, enough, we're done, and now I'm gonna take over, and you no longer have control of this.
Damon starts scouring the internet, trying to find the best rheumatologist in the country.
And through my own investigations, found out that Dr. Maggott was an international expert in rheumatologic diseases of young, healthy people, which led me to believe that he would be an excellent starting point for Jennifer.
Damon writes a long, detailed email explaining Jennifer's medical history to Dr. Stephen Maggott, a renowned rheumatologist in New York.
So I looked it over and I said, there's a good possibility I can help. It would be worth your trip up to the hospital for special surgery.
Hoping to finally get some answers, the couple makes the 1,000-mile trip to New York City.
As soon as I met Dr. Maggott, he just looked smart. And not only did he look smart, but he looked like he'd seen this before.
When Dr. Maggott began to examine Jennifer and speak with us, I felt like he was very focused on some thoughts that he must have already had.
It's said that over 90% of diagnoses can be made simply by the history. So the whole idea is to elicit questions from the patient that can fill in the details. And what I tend to do is have a framework. The idea that she was a younger woman with a chronic illness that had really destroyed at least one of her joints, practically the right elbow, and also involved her eyes. There are a group of illnesses that cause eye inflammation and joint problems. So I started with those and asked myself, could she have any or a group of those illnesses?
He did a physical exam, and he had me do a number of different, exercise activities.
You really do look for clues. You have to be a detective. You have to answer a mystery. Each patient really does have a mystery diagnosis at the end. There are many types of rheumatological illnesses that have skin as a manifestation, so I looked carefully at her skin. Her skin showed some abnormalities, mostly in her scalp.
Then Dr. Maggott conducts a simple spinal motion test, something no other doctor had done before.
Well, Dr. Maggott had me touch my toes,
She came within 9 inches of the ground, which is not so good for a young, flexible person.
Dr. Magid knows that only a few inflammatory diseases present with this unique constellation of symptoms.
He said, did you know that your bottom vertebrae are fused and that you bend at a 90-degree angle? At that point, he kind of just smiled and he knew what was going on.
It was her age, her gender, the chronic inflammation of joints, and very clear-cut abnormalities in her spine. All this information narrowed it down to undifferentiated seronegative spondyloarthropathy.
Undifferentiated seronegative spondyloarthropathy is an autoimmune disease affecting 2 or more joints on one body. It causes the immune system to attack healthy tissue. Joints then become swollen and painful. Untreated, these joints slowly debilitate to total immobility.
It comes down to chemicals and cells being produced in joints that incite what I call a joint riot. Swelling occurs because fluid builds up, tissue builds up, almost like having a cancer that doesn't spread. It just sits there and gradually eats away at the cartilage in the bone. It could cause a lifelong suffering and restricted activity, and certainly for somebody in Jennifer's age, that's catastrophic.
I was just stunned. The diagnosis that I've been running from was now right in my face.
She looked at me and said, you know, I don't want to be a sick person. And it was a very sad moment for me.
It was quite clear to me that we couldn't sit back and take a passive course.
Dr. Magid prescribes an injectable anti-inflammatory used to treat certain rheumatoid conditions.
It doesn't cure my disease, but it slows down its progression so that the rest of my body won't end up like my arm.
Jennifer begins the treatment immediately and gradually starts to show signs of improvement.
I began to notice that she didn't complain at all any longer about her thumb, and she complained less and less about her knee. It seemed that things were really beginning to look brighter for her.
Despite the long and painful road to diagnosis, Jennifer was lucky to have seen Dr. Magid when she did. With such a rare condition, she might have gone undiagnosed for a lot longer, and one by one, her joints could have become permanently damaged.
You know, it depends upon physicians' ability to sort through a myriad of historical detail, to do a complete examination, and to put it in perspective. It's really a clinical diagnosis. It comes with experience and luck, and a patient who is dedicated to getting herself better, and a boyfriend who's so supportive that he's able to help her do that.
This whole experience has only increased my faith in doctors and in medicine, because even though it took so long to get a diagnosis, it still proves to me that you can get one.
Jennifer, a few times in her despair, said some things to me like, you know, it's not too late for you to back out. Maybe I might not want to, you know, deal with someone who had all of these potential problems. Nothing was going to shake my concern and love for Jennifer, nothing.
David proposed 2 weeks after I had started taking the medication, and it really felt like a new beginning for everything. I had like rediscovered myself.